couple things with you about your medications.
Okay.
All right, so anytime we give medications, we make sure we have the right patient. That's how I verified you. The right drug. I'm going to give Cefitan 1 gram IV piggyback every 12 hours. I'm going to double check over here and see that right now it's 1 p.m. and the last time you got this was 1 a.m. in the morning. I'm going to make sure we do the right route, which is IV, the right dose, which is 1 gram. I'm going to make sure you have the right education. Do you have any questions about Cefitan or why you're on it?
Is this my pain medicine?
No, this is an IV antibiotic because you have cellulitis in your legs. This is going to help treat the infection.
The chocolate helps too, but
Okay. And when we're talking about the right assessment, which is one of the rights of medication administration, one thing we're looking at is the redness on your leg and the swelling. Has any of that gotten better?
I mean, I guess.
Okay.
I guess.
We'll check that in just a little bit and make sure that it's going down, okay?
Yeah.
And then you do have a right to refuse your medication, although because
won't
that's what you're here
refuse.
for, we don't want you to refuse
Yeah, I'm
it.
not gonna be refusing anything and everything y'all give me. Give it. Just give it here.
Okay. And then
I'm
I'm
not
gonna,
allergic to nothing.
great, you answered one of my questions. You don't have any allergies. And I do want to confirm that. I've already confirmed your name and your date of birth. I'm confirming your orders. I've confirmed them twice. I'm going to count them and look at them and double check them against the medication itself. And then when I'm done, I'm going to document everything. Does that sound good?
Yeah, it sounds real nice.
Does it? Okay,
Yeah,
good.
I mean,
I'm so glad you're on board with
I'm
us
still
today, Miss
hurting,
Fuller.
but I guess I'll just keep eating these chocolates. Y'all just give me that insulin. Help
Okay.
me bring it down. That's what I do. I can have it's just weird. I can eat anything I want. Y'all give me that medicine
It
anyway.
just brings it right down. So the first thing I'm going to do is lower this one because, as we know, secondary works by gravity. I've got my roller clamp closed all the way down so I can prime my bag. This is Cefitan. I'm double checking again that it is 1 gram and it's IV, and I'm going to get every 12 hours. I've already double checked over here, but I'm making sure this is the right medication. I'm going to pop off this little stopper. I'm going to spike my bag, remembering to keep the spike sterile. I'm going to squeeze just enough in my chamber, and I'm going to hang it here. Now, I'm going to take the cap off of this end, trying to keep this end sterile, and then I'm going to prime it just enough. There was already a little bit in there, but I got to get the bubbles out. So just enough to let all the bubbles come through my line. And then if I have any bubbles, like I do, I can flick them all the way up. So you want to make sure there's no big air in the line. Otherwise, we're going to put air in Miss Gladys. Miss Gladys, you don't want air in your arm, do
I
you?
ain't getting no air in that line.
All right, and then I'm going to hook this into the closest port. Remember, if you're going to use a roller clamp to control it, you've got to go with the port above the roller clamp. I'm going to scrub my hub for 30 seconds.
Yeah, scrub it
Scrub,
clean.
scrub, scrub.
This place ain't
Make
the
sure.
cleanest. I need me some new sheets here. They got holes all up
And
in
then
them.
I'm going to put this right here. Now, because I'm going to control this with the main or the primary roller clamp, this clamp needs to be all the way open. So that's wide open. And then I'm going to come down here and I'm going to control it this way. I've already done my math, so I know that I've got to do 60 drops over 1 minute. So that's 1 drop every second. And I'm going to count over 15 seconds. And when I count, I'm going to count this. And I'm going to count until it's about a drop every second. Okay? And that's all. You've already hung your secondary.
Excuse me, nurse. Might have a word with the people in the laundry room.
Uh-huh.
I got holes all up in my sheets. That deems rights for more pain medicines because I'm put out.
See. Okay. I'll let him know.
I'm put out. There's bugs up in here. I mean, I had to put my food in this pan of some sorts. I mean, might have a word. I mean, just stains, just sickening, just nasty.
So I'm going to come over here and I'm going to double check. I gave her Cefitan. I'm going to document that I gave it at 1 p.m. And I'm going to hang it over an hour. It's 100 milliliters. And then I'm done. Do you have any questions for me?
Yes, it's been 5 hours.
No, it's been about 5 minutes. So, are there any alternative pain treatments we can try? You want me to try
What
to
do you
dim the
think?
lights? Where's your pain? Can I get you like a nice blanket?
Whole body
Can I get you
pain.
some ice?
Can
I turn on some soft music for you, Miss Fuller?
soft music?
Yeah.
No, that's not gonna do it. No.
Okay.
No, I'm trying to drink my more fiber drink. I got my lips rolling over here. I got my Listerine squirts over here. And I got my chocolates, and that is not working.
Okay. Let me go call the doctor, and I'll see if we can do
go on and
anything
call
else for your
that
pain
doctor because
medication.
5 hours is ridiculous. Who in the world could wait that long?
All right. I will let you know what they say.
Here,
okay?
give the doc a chocolate. He might. Here, give him these Twizzlers. Here, take these. That might help him. Tell him it's
Thanks.
from Gladys Fuller.
I'll let him
Room
know.
54B.
Okay, Miss Fuller. Thank you. That's plenty. I think this will be plenty. Okay. All right.
Okay.
I'll check back with you in just a bit.
With my pain meds.
Okay. We'll see what the doctor says. Okay.
He gonna say yeah, cause he
Okay.
gonna say yeah, cause Gladys gonna get upset. Gladys gonna be mad.
All right. Well,